I am Dr. Sontakke Santosh, Neurophysician at Ruby Hall Clinic, Pune. Today we are going to discuss about the acute treatment of stroke. As we know, stroke is what we define as an acute onset neurodeficit, which is focal. So, how to identify this stroke? So, we use this B-FAST acronym. B-FAST means what? Acute onset if there is a balance problem, if there is a eye vision problem or diplopia, and then fast means face drooping, arm weakness, speech slurring, and then last one is the time to call the neurologist. So whenever you get these symptoms of acute onset, you always should suspect this might be acute stroke. So then we have to call the neurologist and go to the stroke ready hospital. Stroke ready hospital means where neurologist is available and the facility of MRI, CT scan imaging is available. Acute treatment is very important in first few minutes to hour. This is called as golden hour concept. So in first 4.5 hours, we can give injectable IV clot-busting injection called as thrombolytic agent. So whenever there is a acute onset of these symptoms, then when you rush to the hospital, then you can reverse this process of stroke, because stroke is quite disabling and every minute some of these cells are dying. So then the patient's disability can be accumulated over time. These are the acute treatments. IV, we can give one single bolus of tenectase, what we call as a clot-busting injection, and that improves drastically the chances of independence and without support life after the stroke also. Then there are other emerging therapies like mechanical thrombectomy, where you can remove the clot from the large arteries of the brain vessel and you can reverse the process of this. So whenever there is an acute onset neurodeficit, what we call as with the symptoms of B-FAST, we should always go to the nearest neurologist or a stroke ready hospital and get this golden hour treatment of IV thrombolysis or thrombectomy. Thank you.